We have a generation of kids living in bed and breakfast for long periods of time, and that should be unacceptable.
This report really does matter, because if we want to understand whether a system is functioning, we need to look closely at how it treats its children. Many families told us that for neurodivergent children, temporary accommodation feels like torture, distressing, overwhelming, and traumatizing.
If you're in a very small room where really you're all in the one room all the time, and kitchen might be floors above, bathroom might be shared, I worry about the possibility of childhood in those circumstances.
Elizabeth has ADHD and suspected autism. She has sensory issues, noise affects her a lot. She says her body hurts when it's loud. But this room was a headquarters of noise. I complained, but nobody cared.
And I think in a TA system, we are increasingly losing the human, and we are just counting stats. And even the stats are getting worse, so the human cost is significantly worse.
We know that maintaining school continuity wherever possible is in the best interest of children. It supports educational attainment, emotional well-being, safeguarding, and family resilience when everything else in a child's life may be uncertain.
So children face multiple moves across multiple boroughs, losing all sense of connection, attachment. And then we're starting to see quite a lot of medium-term consequences of that as well.
Official data reveals that homelessness has contributed to the deaths of more than 100 children in England over the past 6 years. Figures from the National Child Mortality Database show that 76 of the deaths were of babies under the age of 1.
A new report today by the Shared Health Foundation is urging the government to put a system in place so schools and GPs are aware when children move, to stop them going missing from the system.
Can I urge you to consider the recommendations for local government in the recent report from the Shared Health Foundation, which is titled Children in Temporary Accommodation, an Absolute Scandal. It focuses on the safeguarding of children, on the need for postnatal support in temporary accommodation, and for practical support, for example, bus passes for children to get to school.
If I am late to school every day and missing lessons and fail to live a life like a normal child because I am homeless, how will my future be bright?
Absolutely ecstatic. This is going to have such a massive impact on so many children right across Greater Manchester. It's going to mean so much to so many families. We don't want the fact that any child has been moved into temporary accommodation out of area to mean that they can't get to school and they miss out on education.
We are currently lobbying the government to ensure that every child in a homeless household has their GP and school informed that they are in temporary.
The government has pledged to stop children growing up in B&Bs and make childcare more accessible for families on universal credit as part of its child poverty strategy.
The government's child poverty strategy will require schools to be told when children are in temporary accommodation and gives councils more funding to stop families staying in B&Bs for more than 6 weeks.
My Lords, I beg to move Government Amendment 50. This regards notifications where children are placed in temporary accommodation, which all noble lords who spoke to this in committee saw as being a clearly sensible change to make sure such children can receive the right support when they need it. I am pleased to tell noble lords that following extensive cross-government work, the government has tabled an amendment to introduce a new duty on local housing authorities to notify educational institutions, GP practices and health visiting services when a child is placed in temporary accommodation if consent is provided.
Housing homeless people, providing decent accommodation, providing proper temporary accommodation and social and council homes has to be at the forefront of what we all believe in.
We have to stop thinking about housing as primarily a financial asset and think about it as a secure, affordable place for people to live, and we want to secure that for everybody.
It's probably one of the biggest challenges that we face, and something that you can't change overnight, but celebrate the wins where you find them.
Give your attention to where you can make change, and that will be much more likely to get stuff done.
If hope dies, society just doesn't progress.
For years, the Shared Health Foundation has collaborated across sectors with a singular mission to reduce the impact of temporary accommodation and homelessness on children. We are incredibly proud of the tangible changes we've made for families, and thanks to the years of cross-sector collaboration, we've successfully driven real policy changes that support families on their journey out of homelessness. But the fight continues. Join us in our ongoing mission to give every child a safe and stable place to call home.